So my name's Belinda Fisher. I'm the Senior Speech Pathologist for Head Start Queensland, a not-for-profit association working with children with language disorders and other difficulties. All of the developmental areas, physical, social, language, speech, have a massive impact on children's lives and their perception of how they're perceived within the world and what they can do. So if they're not able to do something, it often can have a massive impact on their confidence and their reluctance to participate in particular activities or their ability to participate in society in general. The importance of early intervention is to identify those children that are going to have difficulties later on in life. We know that at particular ages things become lifelong, so we want to get in before then. We know that if we know what's going on with a child, we can help them to better understand it and their families to better understand it so they can get better help for them and understand what's going on so there's not a lot of frustration in home life. So speech is the way that we make sounds, so it's all how we put those sounds together to make words, so whether we know that a b is a b or a t is a t. Language is the way that we put the words together, so knowing what words mean, how we use them together in sentences, and then knowing which situations to use particular words, so not being too casual or too formal in any situation. Language is really important because it underpins everything we think about or say or whatever we're thinking in terms of the language. It's just so important in terms of perceiving what's happening in the world around us. Language has a significant impact. If you think about it, it underpins everything they do at school, the way they manage their emotions, their emotional well-being, so their mental health as well, all their interactions they have with other people. So if they don't have that, then they can be affected in all those areas. It can underpin behaviour problems, it can underpin psychological issues, it can even lead to things like academic failure or being incarcerated. If they want to know if their child has any developmental difficulties, going and seeing a speech pathologist or an occupational therapist or a physiotherapist is the first start. Talking to their doctor or GP, also finding out from their educators if there's some difficulties in those areas is always good. We can, from Head Start Queensland, offer some screening sessions to work out if there's a need for further intervention or whether things are tracking along okay at the moment. There are lots of things that parents can do, in fact, and educators, just spending 10 minutes a day with your child, talking or interacting or doing something with them, exploring a new topic or going and doing something that they want to do, having a play with them is good. The research shows that any one-on-one attention that a child gets is really beneficial for the development.